might be what she gave me. Okay. He says, go, Butch.
Ready to go? The meeting of the Board of Ellis County Commissioners will now come to order. Let's stand for the Pledge of Allegiance. I pledge
Allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Donna, if you want to call the roll.
Commissioner Dean Hazelhorst.
Present.
Commission Chair Butch Lyer.
Present.
Commission Destin Rowe.
Present.
We have a quorum present.
Okay, thank you, Donna. Okay, in order of business, any changes to the order of business tonight?
So we do have an executive session.
Okay. Prior minutes, we did get minutes for 6th, 13th, 20th, and August 3rd. Any changes to them?
I had none.
No
Okay,
issues.
none. Okay, the meetings will stand as presented then. Do I hear a motion to approve the consent agenda?
Mr. Chair, I'll make a motion to approve the consent agenda items A through G.
I second that.
We have a motion and a second. All in favor say aye.
Aye.
Motion passes 3-0. Are there any issues from persons not on the order of business? I see no one standing up, so go on. Okay, we have a COVID virus update. Jason.
Good evening, Commissioners. Jason Kennedy, Health Services Director. So actually short update tonight. Things are improving in Ellis County, have continued to improve in Ellis County since our peak, like we talked last week around July 19th. We've really seen a precipitous decline in both our 7-day average case growth and our 7-day average percent of positives. Around July 19th to July 22nd is kind of that time frame where we really started dropping off in both regards. So that is a few days. That's actually depending on which day you use. It's 4 or 5 to 8 days before the actual mask mandate went into place. So I know Dr. Norman came out and said that the counties basically the counties with mask mandates had seen a decline, and the counties that came there that didn't have them had seen a flattening. That was aggregate data from really all of the counties included, not Ellis County. Ellis County has seen a precipitous decline in both of our functions that we really monitor from July 19th to the 22nd, depending on which chart you really look at. So we have continued that decline. Actually, starting August 5th, we have seen a little bit of a flattening of that line. However, we are back to at or slightly below the average, the numbers that we were getting clear back at July 8th. We talked about July 8th. July 4th to July 8th was kind of where we started our acceleration phase. So we are back at those kind of minimal levels. Where that leaves us is we had 5 new cases over the weekend. That includes some cases on Friday. We have 12 active cases that we're still actively monitoring in Ellis County. We have 2 hospitalizations and still stand at 1 death that we've talked about before. Like I said, so we are on that downhill slope, or have been for quite a while. That's good as we're looking at moving back into school, things like that. We need people to still make good decisions. Not gathering in groups is really the biggest thing. If you avoid contact with other people, you likely reduce your chance of getting COVID. Continue to pay attention, watch our website. We'll continue to put information out, and make good choices. Wash your hands, don't touch your eyes, nose, or mouth. Wash your mask, and continue to be smart.
Any idea how many people have been tested in Ellis County since this all started?
I knew you'd ask me the one thing I don't have. 20.
Hey, and it's okay.
It's
no big
no,
deal.
we have it on our website. 2,800-ish, I believe.
Really?
Let me.
It's okay.
see
I
if
was
can
just
pull it up.
curious.
It's right around that number.
That's good enough. I was just curious.
Yeah, we posted on our portal, so we put number of tests completed, number of positive tests. Some people get a little confused. We have more cases than we have positive tests, and that's because of the probable cases that we've talked about before. And Sometimes our data is a few off from KDHE's data, but that's because everything's manually input at the KDHE and for us. So if their reporting time frame is a few hours different than ours, then our cases can, but we're always within a few cases of what the KDHE has.
Good. Thank
Jason,
you.
to try to test everyone who's been named as a contact.
No, so the KDHE is actually still not recommending asymptomatic testing. We will do asymptomatic testing for certain cohort populations, and what that really means is first responders that have been exposed. If we have long-term care residents are really the big ones that we've seen, and we've been through that before here. If we have a positive in a long-term care, we'll go through and test all staff, all patients. But as far as just general public, unless you're an extremely high risk category, or you have a extremely high incidence with your contact, and that would be up to your primary care physician really to determine that. But KDHE is still not, and CDC is not recommending asymptomatic testing.
Only testing people with symptoms.
Yeah, for the most part, the majority of
But
it.
what will happen when the cold and flu season starts and everyone has symptoms?
So what the guidance I've seen, everything is really up to the primary care physician to determine.
Okay.
That is their job as a doctor, and the best thing we can do is let doctors be doctors and try to figure that out because they've done it for a long time. And in Ellis County, our doctors have done a phenomenal job of really going through kind of a pre-programmed algorithm of looking at your symptoms, seeing what they need to test you for, whether they test you for flu, whether they test you for strep, whether they test you for COVID. Generally, they will test in an order of what is the most likely diagnosis, and if that test comes back as positive, then they usually will treat for that. But that will be up to the primary care physician to determine.
Okay. Commissioner Ross, any questions?
Jason, as far as population density, I always think about our peer counties and how we're doing comparative to them. Do you have any kind of metric on that?
Sure. Yeah, you look in KDHE. I don't have it off the top of my head for you tonight, which I can prepare that next time. I can put together a slideshow or something. But we're still significantly lower than most of the counties based on population density. The last time we talked, we were like around 25th, and we're like the 15th biggest county as far as population density. So we're still doing pretty well. And with our case counts continuing to drop off, we continue to do well in that regard. Some of the western Kansas counties are experiencing, or further western Kansas counties are experiencing some of the growth, same as we did. Viruses travel in vectors. If your vector's in your county, you're going to see an acceleration phase around it until it can either mitigate itself out or the measures that you take can mitigate that risk. So we'll continue to see waves of virus as it's still in our county. It's not gone from our county. As people go and travel, gather in groups, all that kind of stuff, you're going to see it. We'll continue to see those waves for, like we've talked, the foreseeable future. COVID will not go away. We will not see a time where COVID is no more, at least not in my lifetime. Even with a vaccine is not an on-off switch. So COVID is here. How we deal and how we react to COVID is what will determine what our future looks like.
Okay. Discuss flattening the curve and not moving the goalposts on the public. I'm sure you're always in contact with Hayes Med and who they deal with all around our area. Obviously, a big medical center for the whole area. Any issues with stressing our medical system?
No, not right now. Right now, we report Ellis County hospitalizations on our website. We don't actively report Hayes Med's data,
right,
because that's Hayes Med's data. But we are in contact with them. We have a great working relationship and have actually been able to partner up with them on a lot of stuff through COVID. So I got a lot of respect for what they do out there and the access they've given to us as far as kind of knowing what's going on. And we have kind of predetermined metrics that they will say, hey, well, we gotta make some changes or whatever. But their data is their data.
Okay.
Ellis County data is mine.
Well, I imagine we're going to discuss mask and of course Hayes mask mandate and how it will actually end right before a Labor Day holiday weekend, which I think is the 4th of July holiday weekend was what caused us quite a bit of uptick in our coronavirus cases. Obviously 22,000 of our 28,000 people and their mask mandate makes a big effect on how we decide on mitigating measures as a county board of health. I would say that's just my concern as we pull off a mask mandate and then everybody goes for Labor Day weekend activities and then there's some sort of claim that masks were the reason why we were keeping our numbers low or things like that. Can you speak to that data and especially the mitigating factor that we're hoping to hold on to in our tool chest in terms of when we actually see issues in Ellis County?
So, yes and no. We're still within the first latency period, the first period of the virus. We're still within that 14 days.
Okay.
So, as you go with mitigating measures, that generally they compound, or your hope is that they compound and they continue to make bigger increases. But you also can't really look at the data until you're looking back. So you have to be at the end of that period to really look back on the data. What we see right now is that we have had that precipitous decline really since the 19th, 22nd, somewhere around in that time frame, where we actually didn't have any mitigating measures in place.
Right.
Now, mask mandate or no mask mandate, whatever your county, city, whatever mandates, doesn't mean that should necessarily change your decision
Okay.
to make good choices. So if, regardless of what happens with the city mandate or what happens with mitigating measures, it takes community buy-in, it takes people believing in you, believing in the measures, and taking it upon themselves to do them. And that's regardless of mandates.
Well, you're doing a great job of teaching people, and I think that is the most important role you have, I guess, right now, until we actually have to discuss mitigating measures.
Right now, what we need to do is we need people to get healthy, which means that they need to make healthy lifestyle choices. They need to get back and see their doctors. They need to come in and get immunizations at the health department. The healthier a population is, the better it can battle a virus, regardless of mitigating measures.
Okay.
Our numbers at the health department, which you guys will see in the report, our numbers at the health department, our immunizations are down. That's because people are afraid to go out and get care. We need people to go in, see their doctors, be smart. You know, if we want to make the biggest impact in the country right now, we'd probably mandate everybody go for a 30-minute jog every day. It would help with all things that kill us, not just COVID. So, if as we look at this, we need people to start reaching back out, getting back into get that medical care and get healthy.
I believe that the statistic is 5 times more people will die of heart failure this year than COVID-19.
I won't speak to that one. I don't have all the stats, but it's healthy lifestyle choices. The healthier you are, the better you can battle a virus, and the healthier your population is, the better that your population can battle a virus. So, making
Very
smart
good.
choices, doing the simple basic mitigation measures regardless of what is mandated.
Well, thank you for teaching everybody about how this virus spreads, and they have the information as long as they're willing to go look at it and buy into it.
You can always go to our website, Facebook. We try to get some good information up there, and like I said, right now it's a time where we need kids to get in and get vaccinations for back to school stuff. We need adults to get in and get vaccinations. We're looking at spooling up for the flu season. We need people to really get those medical treatments that they need to be as healthy as possible going into cold and flu season.
Jason, thank you.
Yep.
Keep up the good work. Okay, next we have the budget hearing for the 2021 Ellis County and Fire District. We need to have a motion to open the public hearing.
I move the commission open the public hearing on the county and fire district budgets for 2021.
Second?
Have a motion and a second. All in favor say aye.
Aye.
Motion passes 3-0. Okay, JD.
Thank you, Commissioners. I'd like to, Darren Myers has been working on the budget kind of from the get-go, so I've invited him in this evening to head up that task.
I'm a little shorter than Jason. Move this down. Good evening, Commission. Darren Myers, Director of Fire and Emergency Management. Normal process this time of year is to open up a public hearing to go into discussions about our budget, so that way it can be formally discussed and then adopted afterwards. Just wanted to touch a couple of different things throughout our budget process this year. As the Commission has well stated, you all wanted to keep the mill levy the same at that 36.91 mils. We accomplished that. There is no mill levy increase. However, with previous discussions with that mill levy the same and oil valuations going down, the revenue that the county has generated has also gone down. If you look at that in the vice, or in the opposite, if we were to actually take what the tax lid would allow us and be able to hit that 1.8 cap on what we could actually increase the property taxes. We would roughly come from where we're at today at 14.3 million, and that would be adjusted all the way up to about just over 15.2. So it's about $915,000 difference that we could be bringing in revenue in additional property taxes. However, with the mill levy staying the same, we actually took a decrease. The good news is the sales tax passed. So with the additional sales taxes coming in for the county, and at the commission's direction, we have not increased expenditures. And that additional revenue is being put into to help budget a certain line item, so that way we can increase our reserves. This year, I don't remember the exact number off the top of my head, but it's about 2.08 million that will be budgeted and set there in reserves, so that way we can start building our unencumbered balance over the years and get the county back into a better financial shape. One thing that I will point out that when the county administrator and myself went in through the S&P rating for the county's financial rating, one of the things that they did notice was that our budgeting practice and spending down, having a budget deficit over the several, I don't remember how many years that has actually been. That was one of the negative contributing factors to where we're at. However, they have identified that with this budget proposal in front of the commission tonight, the changes that have been made, they see that there's a positive forecast for Ellis County in changing those practices of starting to be able to build reserves again. Also, one thing to keep in mind, two more things I want to point out. The biggest is our health insurance. The commission has yet to see that proposal in front of you. However, hopefully within the next month, the commission will be able to make a decision on how we want to progress with health insurance. As the commission is aware, we've been in discussion with Freedom's Claims Management and looking at coming off the state system and onto a multi-level, multifaceted health insurance plan. We did get the new numbers for the second half of 2021, and preliminary estimates from where employees are at now on the health plan and their types of plans and policies. We're looking at saving $300,000 just in Ellis County expenses on health insurance next year. So basically, if we would have stayed with the health plan, we would have to increase our budget by about $300,000 to accomplish keeping up with those premiums. That is also by splitting that difference up to 86 and 14% cost share with the employees. Just on the employees' side themselves, it's estimated that we're just under $50,000 that the employees out of their paychecks that they're going to be able to keep with not having to pay more. So not only is Ellis County saving, the employees are also going to be saving as well. The last thing that I want to point out on the budget is that the bond payments that we're getting ready to discuss had exceptional bond sale, which Larry will discuss with you in a little bit, which means that the better interest rate that we receive, which means the less principal and interest payments that we're going to be making annually. So in the future years, we'll be able to use some of that general fund sales tax that we get in, whether it comes in at or above. We can maybe reallocate that and be able to use that in the future, or continue to put that into reserves or build our unencumbered cash as well. Not a big chunk of money, but every little bit helps. That is it on the general fund, and the fire district is a little different because of those oil and gas revenues that have a much larger impact on the fire district's budget. The max that the county could levy without going to resolution to a vote or anything else would be $569,140, and that is what the budget is set at. So it is a slight mill levy increase. However, it does not include the populations of Hayes, Ellis, Victoria, or Shinshin. It's just the rural areas. So it's a lot smaller of an impact per household or per family, per resident than on the general fund, of course. So with that, I will let my speech be done, and I don't know if we have anybody else that wants to talk, but that's the kind of good overview of where we're at.
Anyone in the audience have any questions?
I have just a couple questions for Darren, if nobody
Sure.
in the audience does. Okay, Darren, looking at, you said 2.08 million that we should add in unencumbered cash next year from this budget. Where does that put us as far as the audit that we did and our approximate $1 million more than we had 2019? Where should we be at? Say we go exactly as budgeted next in the 2021 session.
So we're actually meeting the policy of where we need to be at around $3 million for the unencumbered cash. However, the set aside, I believe, was 35% is what we have our budget policy said, which is about 5.2 some million.
Okay.
So it may take us a couple years to get to that point, and we couldn't expect that to happen overnight. But the unencumbered cash, I believe, estimated this year is going to be, because our audit is not here yet. Adams, Brown, Barron, and Ball is waiting on a department to get some financial figures back to them so they can complete that at 100%. I don't know if JD has talked to them or not, but probably the 17th or September 1st, they should be here to present the audit and give you that exact final 2020 unencumbered cash rollover. But it should be right at $4 million.
Around 4 after 2021.
And no, I have not heard from them yet on the date on that. And I was just going to comment, 20% is usually a good go-to number as far as reserves are concerned. And if we set our goal to be 35, that's outstanding.
Mm-hmm.
Okay.
Any other questions, Commissioner?
And I believe that you spoke to the idea that we're spending less money has affected our credit score in terms of our AA- rating, and how we went out to bond. It's kind of interesting. I think it's how all credit works. I don't understand that. If you have a lot of money in the bank but you don't use credit, sometimes it affects your credit score negatively as opposed to positively. So I'm glad you discussed that with us, but I think, as far as those bond ratings go and how we get them, I think cash in the bank is probably better than us worrying about getting a AA plus or whatever rating. I believe, and then the healthcare, you said it was about $300,000 in savings, Darren, with the potential healthcare savings that we have coming up, and that's with an 86-14 cost share. Okay.
Correct.
I just wanted to double check that was the correct way that we had done that on there.
And that's not figured off what we're paying today. That's what we would pay with the new premiums from the state because they change twice a year. You pay one rate from January to June and then a second rate from July to December. And we just got those July to December rates here a couple weeks to a month ago. So.
Okay, that sparks my mind to the idea of the question of unencumbered cash in that healthcare policy. I know we're putting money away. How is that money treated in that fund in the new healthcare plan?
So with our new policy, it's a two-part system. You'll have an umbrella policy with Blue Cross Blue Shield came in as a low bid, which made our employees very happy.
Yeah.
Vision Care Direct was the vision side of it, and Delta Dental was the dental side. So you combine all that together, that'll be your umbrella policy, which is not as good of a policy as we have now. Then we move into the second part of this two-tiered plan, which is the medical expense reimbursement program, and that's partially like a self-funded. So we say these are the benefits that we're going to reduce that umbrella policy out of, and then this is how much it's going to cost. Now, if you do that, your goal would be to have a minimum or a good starting point of funding that at 100%. Funding that at 100% basically means that every single employee and then their spouse, if they're on the plan, and their children, if every one of them meets their deductible out of that medical expense reimbursement program, we would use 100% of that. So if you fund it at 100%, we're basically always covered. And we were right there, 99.87%, I believe.
Okay.
Now, we all know that all 400 or 500, by the time you took the employees, the spouses, and their children, not all of them are going to meet anywhere close to meeting all of those deductibles. So all that savings below that will stay in that account. It'll roll over. We can gain interest on it. And then in the future, the commission can continue to use that to better employee benefits. You could use it to help account for the cost of inflation for that next year, et cetera. The worst thing that we could do is start pulling it to use it for other items. We want to keep that in there so that way we can continue to fund it. Now, if it starts to grow, because we're only using it, last year in 2019, what we paid for the state health care plan compared to the claims that they paid out was $1 million difference. So if we would have had this in our account last year or in 2019, we would roughly have about $1 million left over into that medical expense reimbursement plan to help pay for future expenses, gain interest annually or monthly, and not just at the state and they get to keep the money.
Are we funding that next year? What's the plan? I think you
It
had
was
told me like 700,000.
the two different ones, or the percentage?
Yeah. No, I mean the total dollars that we plan to put into that fund, that medical reimbursement fund.
I'd have to look. It's
Okay.
I did not bring any of the health insurance stuff with me,
That's okay.
but it basically, it funds it at, it's figured by the individual rate the employee pays, and then the employee and the county put it all into a fund, and then the Blue Cross Blue Shield will pull their money out on a monthly basis. They'll pull out the claims from Freedom Claims, and then the management fee that we pay Freedom Claims to help monitor that whole entire separate system for us.
It sounds like that presents a really good opportunity with our health department and our employees in terms of staying healthy and their potential to save money over time.
Absolutely.
For future years. As we get going into it, I imagine in the year 2, 3, 4, we could really do some incentivizing of sending people to our health department and having them spend that money in the county, and also incentivizing them to stay healthy, because in the long run, that saves everybody a lot of money. So,
Absolutely.
Yep.
very good. That's it from me.
Any questions?
I really don't. Darren put it together very well. Thank you, Darren, for all your hard work on that. I know you spent countless hours on that, so thank you again for all your time, but no, I don't have any questions. Very well put together.
No, I have no questions either, Darren. Again, to reiterate what Dean said, thank you for your hard work and for all the department heads for their contributions to this budget too. I'm glad we had the sales tax passed. It made our work here much more easier.
I think
Thank you, Darren.
it has saved quite a few jobs in Ellis County.
Yes, it did.
During the coronavirus. I don't think that we would have the amount of people employed right now that we have if it weren't for that sales tax. So I appreciate the community going to bat and realizing that, and/or appreciating the way that we spend money in Ellis County, and because that's their hard-earned cash that we're putting to work for them. Hopefully they feel that way anyway.
Okay. Thank you, Darren.
Thanks, Darren.
Okay. Any other questions, comments? Okay, we'll need a motion to close the public hearing.
I'll make a motion to close the public hearing budget meeting.
I second that.
Have a motion and a second. All in favor say aye.
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 Motion passes 3-0. And then we need a motion to adopt the county and fire district budgets for 2021.
I move the commission adopt the county and fire district budgets for 2021 as presented by staff.
Second.
We have a motion and a second. All in favor say aye.
Aye.
Motion passes 3-0. Okay, next we have the R&B bonds from Ransom Financial.
Good evening, Larry Kleeman with Ransom Financial, acting as the county's financial advisor. As you're aware, you guys authorized a bond sale for road and bridge improvements a couple months ago, and we had that bond sale this morning at 11 o'clock. Darren's handing out a little handout that I will go through, just a few pages. And we had a great sale today. I mean, that's the bottom line. We had 14 bidders sign up online, and only 10 of them, which is a lot, 10 submitted bids, which you see on the first page there. Typically, we'd be happy with 4 or 5 bids, but the bond market's crazy right now. Rates are really low. People are hungry for a safe investment, and so underwriters are willing to step up and bid and try to buy bonds wherever they want, because they have other people, moms and pops, other banks that are willing to buy them. Underwriters typically buy bonds from you guys, the issuer, and turn around and resell it to banks or investors and such. And so here on page 1, we have the 10 bids. And the way they do it, they put an interest rate for each maturity. We're issuing 10 years of bonds. We have basically roughly $500,000 each year, 10 maturities, and they put an interest rate for each maturity. Typically, the interest rate increases as they go out. But more and more, just so you know, bond underwriters, they'll put a higher interest rate on the bond, and then they turn around and resell it to the bank or the investor, grandma and grandpa, at a higher amount. So for example, a $5,000 chunk of bond, they might turn around and say, hey, banker or grandma and grandpa, we have this 1% bond. Now you're only making, what, 0% with your money in the bank, so you're willing to pay more for this $5,000 bond. They may be willing to pay $5,500 for the bond. So it brings in that $500 premium. We call those premium bonds. That's kind of the way they do it nowadays. So the underwriters, all of these virtually, have planning to turn around and resell these at a premium. And most of them, including the winning bidder, are providing you the bulk of that premium back. So, for example, the Country Club Bank, they're the winning bidder today. They have interest rates of 1% on each of the 10 maturities. The total interest cost there is $309,000. And again, they're selling these as premium bonds, and they're bringing in over $100,000 in premium, and they're handing that premium to you guys as well. So even though you're selling $5.4 million in bonds, they're paying you roughly $5.5 million. And once you do the math, that equates to a average interest rate of not 1%, but actually 0.64%. So it's a really good deal that you're getting there. The other interest rates from the other 10 bidders range all the way up to, looks like 0.96% with Huntington Securities. Most of these bidders are from out of state. A few of these are regional, Commerce and Country Club and UMB. They're in the Kansas City, Missouri area. Because the bid had a premium, we actually can lower the bond amount because you only needed $5.3 million for your project. So on the next page, we show the resizing amount, which we did right after the bottom bids came in for Country Club Bank, the winning bid. Instead of $5.4 million, on the upper left there, page 2, you see 5.325 is the actual amount of bonds. We were able to lower that because they're going to turn around and resell these at an extra $100,000, and you'll actually get about $5.4 million for this bond that you'll end up paying back in the amount of $5.3 million. So that's how they bring in extra money that you can utilize and lowers the effective interest rate. As you can see actually on this page too, I highlighted in yellow the actual rates that Country Club is going to turn around and resell those for. We call those the reoffering yields. Year number 1 is 0.17%, all the way up to year 10 in 2030, 0.75%. And so, yeah, when you do the math, then that brings in about a little over $100,000 in extra premium for these bonds. Page 3, the next page, summarizes the debt service schedule. The goal here was to keep it under $600,000 each year for annual debt service, and because of the much lower than anticipated interest rate, your average interest cost there is about $560,000 to $565,000 each year. So you'll have extra money left over that you hadn't planned on. Page 4, this just summarizes some of the fine details of where the money is coming and going. In the top line there, you're issuing bonds in the amount of $5,325,000. Because they're premium bonds, Country Club, the underwriter, is giving you an extra $132,000. So you're actually bringing in a little over $5.4 million with this bond sale. Part of it goes toward the underwriter, Country Club's profit. They're going to make $26,000 on this. Part of it goes toward paying cost of issuance, $65,000. That includes our fee of financial advisor, bond counsel, rating fee, and a few other fees there. Then $5.36 million is going to your project fund for road and bridge improvements. And the bottom there is just a little rounding amount, roughly $4,000, which can go into your project fund as well. And again, the cost of issuance details are there at the bottom of that page. Next page 5, that just shows the calendar that we've been through over the past few months. The county approved the sales tax. That goes into effect October 1 to start bringing in revenue to pay off these bonds and have some left over, obviously. Today, at the bottom there, August 10th is the bond sale. You'll approve the 2 motions. One, the best bond bid from Country Club, and a second motion to approve a bond resolution authorizing the bonds to be issued with the details of the bonds. And then there'll be a few signature pages for the chairman and the clerk to sign, and we'll gather those up, and Attorney General and State Treasurer have to sign off on those. And then a couple weeks later, August 26th is the date of closing. That's when the Country Club will wire in the funds to the county's bank account. And you'll have the new bonds outstanding at the new low interest rate. So, any questions on the numbers or the process? I think you already have in your package the resolution. It might have blanks in it, but those have been filled in by bond counsel this afternoon with the pertinent information. As I said, there'll be signature pages to sign, and those 2 motions are really all you need.
Good job.
Good job, dude. Yeah, as Darren mentioned, and JD mentioned, you got an AA- rating, and that's what you've had, I think, in a previous bond issue many years ago, so it shows you're staying stable, and that is a really good rating. Ratings go from AAA, AA, single A, and even below a single A. Just for comparison, down the road, Thomas County, we did last year, I think they had an A+ rating, which is lower than the AA- you have. I think you're a bigger or metropolitan county. Johnson County, they're a whole different ballgame. I think they might be closer to a AAA rating, but that's just because they're Johnson County. But yeah, AA- is certainly a great rating, and it showed with the 10 bids you got today and the low interest rates, and it's a perfect time to sell bonds too with the interest rate environment right now too. So.
Perfect.
Larry, on this, the 26th is when we can start fixing roads, essentially, is when that money will be transferred.
Yeah, and you can actually start spending money. I mean, you approved a resolution of intent several months ago that says you can start spending money and get reimbursed. So if you've already spent money related to this project, you can get reimbursed from the bonds. But yeah, the money will hit the bank account August 26th.
Okay. Any other questions, gentlemen?
I have none. Again, good job. Thank you for your hard work.
Thanks, guys.
Okay, I do need 2 resolutions, or excuse me, 2 motions.
Do you want these both at the same time, or is that how we need to do it?
Should we do both at the same time?
Your prerogative. You can do that if you want.
Whatever you want to do, Dustin.
We'll do that. I move that the best bid for the bonds be accepted and authorize the chairman and clerk to sign the bid form. And I move to adopt Resolution 20-13, which authorizes the issuance of the bonds and prescribes the form and details thereof.
I'll second that and second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0.
Thank you, Larry.
Thanks, guys.
Thank you.
Okay, county road signs. Bill?
Good evening, Commissioners. Bill Ring, Director of Public Works. Excuse me. Before you tonight, there is a agenda item on changing out a stop sign with a yield sign and then adding a second yield sign. Anytime we have traffic directional, where it's not directional, traffic regulatory stop signs, you've done that in the past, that does take commission action. And it also takes a recommendation from the road engineer, which is included in the picture. When they did the high-risk rural road grant for that area, they had added a stop sign there, the one that would be in the upper right of the picture. And they're recommending, because of traffic flow and sight lines and a few other things, that it would be better served for the oil community that drives the big trucks to be able to continue through that if there's a clearance on the road. If there's nothing coming. And then at the same time, at the opposite end of that site triangle, to add a second yield sign for people that are coming to the west on Saline and then curving to the south. So that, because it's very open intersection, it's very visible, but instead of making every one of the oil tankers stop every single time and then start going again, it would make the flow a lot smoother. So there's a recommendation there, it's written above, that's from John Riggins, the Vice President of Kirk and Michael Engineering, who is the firm that we use for all the high-risk oil road grants, giving you the guidance that would be needed, should the commission decide to allow us to change that out.
Bill, was this change requested by someone?
Numerous oil companies and
Okay,
plus our sign man, when he first got wind of it, and he went up and looked at it and sat there and basically did a visual survey of the intersection. And then he also drives a fairly large truck. And so in going through the intersection and seeing the flow, he felt it would be better served for everyone up there.
okay. Questions, Commissioner Hazelhurst?
I drive it all the time, so I have no questions.
Are
Commissioner
you in
Ross?
agreement?
Yes, I am.
Okay.
Commissioner Ross?
Bill, do we maintain that grassy area in the middle? Is that ours?
Yes,
Okay.
that would be ours. That's in the county right away. So we would mow that, okay, just like we mow all the,
Okay. As long as we're mowing it, that was my only concern was.
for sight distance, yeah.
Yeah, yeah.
Correct.
Because I've
Right.
had a couple calls, and I'm sure you get these calls all the time about farmers pushing the limits out towards intersections and things like that. And
Multiple calls today about that.
yeah, I've received a few calls about that. Obviously, this is a tough thing for you. It's a tough thing for a commission who loves farmers, but also needs our roads to be safe out in the county. And it's a tough thing from a kid that grew up in a farming family who knows my relatives have pushed the envelope with pushing towards sightline distance and things like that over the years in our lives. So as long as we're maintaining that area, yeah, it doesn't make a whole lot of sense to make them stop there, and it seems pretty wide open and invisible for everybody to see what's going on. So
Okay,
no issues from me.
okay. Commissioner, would you like to make a motion?
I move that the commission approve the replacement of the existing stop sign with a yield sign at the intersection of Saline River Road and Toulon Avenue, and add a yield sign at the opposite end of the road triangle as per the engineering recommendation.
I second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0.
And then I would just like to bring something to your attention and then bring it back at a later date, talking about signs. This says road closed when muddy/wet. Okay. This is in reference to what happens 210th between Old 40 and the Golf Course Road. There's numerous times we've had that conversation, whatever.
Oh, yeah.
So that you understand signage, when you're out traveling and there's a yellow sign, usually they're somewhat of a diamond shape, it might point that there's a curve or whatever. Those are warning signs. That's giving you advice that there's a curve and we add a 30 mile an hour. That's not truly the speed limit, that's a recommendation. When it's a black and white sign, as in speed limit signs, that's something that can be enforced. This was one of the last things that Norm Bowers, who was a recently retired state engineer, recommended, came from another county. This would give the sheriff's department the ability to ticket someone who goes down, as an example, 210th. Because we did, and we brought it to you, I'd probably been 2 years now, we, at a different recommendation, we added yellow signs that said muddy when wet. All those signs have gone missing. And I'm sure they're slippery when wet. And so we've lost many of those and probably know where they're located. So if this is something that you would want to consider, I believe we would have to do it by resolution, or at least some form of official action. But to give the Road and Bridge Department the authority to add these and it's not many, but it would help us immensely, especially say on 210th, because right now, we had it over the last weekend with all the rains. Some farmers tried to cut through and they got their farm equipment stuck out. No one ever notified us, never called us, and apparently it never caused a problem for the sheriff's department went out there, they were able to get through whatever. But we've had numerous accidents, we've had numerous stuck vehicles, we've had stuck ambulances, stuck fire trucks. And until such time as we could, and, we talked about that as a possible expense, but we're probably talking, I don't know, $500,000 to try to rebuild that into a true road by right of way. It would give us some kind of relief for the people that continue to drive it when they shouldn't.
Is that road traveled heavily?
It's traveled a lot by the locals that need to be out there, the farmers, the oil field people, whatever. But most of the people that create the issues are kids traveling at nighttime. They're out cruising. They want to go out in their four-wheel drives. And that's where we've had more issues than anything. The people that know the road know what the conditions, don't drive it at night when it's raining, like tonight. It's not.
Bill, I'm always concerned about the bottom line on this. Obviously, you said we've had ambulances stuck, we've had all kinds of issues and wear and tear on our vehicles, things like that. How does a resolution like that work if we were to put an enforceable sign up? Do we set the fine? Is the fine set by state statute? And where does that money go if they are fined?
I would direct that if you want me to proceed to meet with Mr. Jeter about how that would be structured. Yeah.
So it's not about the bottom line, it's
No.
just about deterrence. Okay.
I believe in, like, if the sheriff's office writes a speeding ticket, that money leaves the county.
Right.
Not to return.
I need that, yep.
So, and I'm sure in statute, there's preset amounts that, in adding a sign, some form of a regulatory sign.
Yeah, I don't mind adding a deterrence. I think then it becomes a sheriff's issue if they can determine whether the person was there to work or the person was there to go make out with their girlfriend on the hill up there, whatever. So I think that leaves them a little bit of a leeway, I guess, to say this person was trying to do.
It allows them to enforce something.
Yeah,
They
yeah.
can't, there's really
Right now, they got
nothing
no
they can do
recourse.
now.
Yeah.
And the other thing that we have, which causes some more concerns, is the towing companies will no longer go out there.
Okay.
So we have vehicles that are left there for days. And yet, when we go out and we close, when we find out, we put barricades, it's 3-mile stretch of road, there's no crossroads. And we'll set barricades, close the road, but people go out there that shouldn't, they'll pull them aside, and then they'll go cruising, and we've actually had people run into other people at nighttime into broke-down vehicles.
Can these road signs have fines will be enforced for those that pass this? Because I would think if I saw that, I just wouldn't think of it as that enforceable, even though I probably should know. I think it would maybe be more deterrent, since it's not our bottom line, to add something that fines will be enforced if you're caught going past these barriers.
I can follow up and see if there is basically what you'd say a caveat that we could put, like on a stop sign, it now says all way.
Yeah.
That means it's all 4 ways, or if it's a 3-way, they all have to stop, you're telling. So that's added information.
Right. Yeah, I would think that would be a little bit more of a deterrence than that. But I'm happy, like I say, I know we have all kinds of problems with that, but frankly, I don't know that it's traveled heavily enough that we want to spend a ton of money to get it fixed. But if we can keep people off of it when it's raining, I think.
Well, it's
a
for
lot
their
of
own
the problem-
safety, and that's, and our responders also. I mean, that one
Yeah.
night out there, Darren, you were, I believe, out there that night, and we pulled out a fire truck, we pulled out a police car, we pulled out an ambulance that I know of.
Mhm.
And that's not a good position to be in. And now only because of the local farmer that lived there, who we know, he brought his tractor out to help us out with it.
And that's wear and tear on his tractor that he probably doesn't want. Not to mention, like you said, this is just recreational travel that is our biggest problem.
Correct.
And you know, we don't want that issue up there, especially first responders and things like that. So I would be in favor of any kind of way that we can get people to abide by these things a little better, whether it be a fine or whatever.
Right.
Yeah,
Well,
I
if
would
it
have
wor-
no objection to it.
Okay. Well, if it works for the commission, I'll work with Mr. Jeter, and then maybe for the first meeting, because I'll have to research this the first meeting, and I'll follow up on your question about adding on, come back to you with something formal that could be possibly voted upon, if that works.
I think there's danger to our economic drivers out there if we've got recreational vehicles we can't pull out that are in the way even as it starts drying up through the middle of the day. So I'm happy to try and deter some way or another.
Well, we recently had a road in, over outside of Victoria. We had a car stuck and left in the middle of the road for a week because the tow truck companies would not go get it. Well, that's not conducive for the farmers that have, say, a four-wheel drive tractor that could go down the road.
Yeah.
And we can't be putting a burden on them, and we don't want to, you know, for someone that, and again, it was an out-of-state car, they're at cruising, you know, do we really want to ask a local to possibly damage a piece of their equipment to pull somebody out?
The savings on that diesel for that tractor when they got to go a mile around might be enough for them to set back away from the road with their Milo crop.
Okay.
Okay,
Well, we'll reach back out to you then. Thank you
okay, thank you, Bill.
for both.
Okay, next, County Administrator Report. JD?
Good evening. I have one item as a follow-up from the last meeting. We did, Bill Jeter and I did work together to put together a acknowledge form for the folks that rent the Schenck Enrine building. We did revisit that after I received a phone call earlier today, and so it no longer includes an actual number and the size of the crowd, but just encourages for the crowd size to be limited. So that has been done.
Okay.
It's going to be a fairly short report tonight, but I'm happy to answer any questions you might have. And that's regarding the Ellis Cares program for the remainder of my report. There has been a flurry of activity since we last met. The Ellis Cares group has met twice via Zoom, and then a whole host of phone calls have occurred in addition to those two big meetings. One of those meetings occurred just this morning. A week ago, the group had targeted buckets of money. Let me run through those for you real quick. Previously, the reimbursement requests were right at $500,000, and so that's for the county and for the cities. Planned county expenditures were at $1.8 million and remain at that point yet today. Of that, $1.5 million is for the computer-aided dispatch program that will benefit not only the county, but all the municipalities in the county, all the public safety organizations. And as a quick side, I'm spending a little time on this because it's probably the big ticket item in the whole thing. Darren, who's done a great job in all this, by the way, including the budget. But Darren did send a note to the state asking them specifically about this project. to ensure that we received a thumbs up from them, and we did receive that. So, in fact, they wrote us a couple of paragraphs on why they felt it was a worthy project and eligible. So, so that is the big project. It is well supported by the other entities as well. City of Hayes, the other cities are supporting it very strongly as well. So, so then in direct aid, there was about $8.6 million of requests. And again, our total that we have is $5.7 million. So there was obviously some pencil sharpening that needed to occur kind of across the board. From that, we had about $1.1 million in educational requests, government transfers, which is government requests. So from the other, the county has pulled out that $1.8 million I mentioned a moment ago. The other municipalities requested about $515,000. And then the for-profits was a big chunk. We had about $5.1 million in requests from them, and then $1.8 million, $1.9 million from nonprofits. So the group set out target buckets of $1 million for education, $1 million for for-profit, and $1 million for nonprofit. And then it was farmed out. We had a subcommittee that looked at and vetted the educational needs. And then we had a different group, which is the Heartland Foundation, went through, and they're used to doing grants to nonprofits, so they took on that task. And then we had another group, primarily the Grow Hayes folks that are associated with Doug Williams, that took up the for-profits. And so those groups came back today and reported back, and the nonprofits and the educational needs came in right around the $1 million target. And then the for-profits came in the Grow Hayes group, not Grow Hayes, but the folks that reviewed those, they came back with about $890,000 of initial recommendations. After further discussion today, there was some give and take in what they thought were priorities of one group compared to another, and so further work is being done on it as we speak over today and then tomorrow. And so we are going to have yet another meeting on Wednesday morning to further discuss it and come up with a plan that would be recommended to you all then Thursday morning. And so the numbers are still being worked on. Our goal date is for Friday. To have it submitted to the state. Is due on the 15th. Technically, we haven't. They're going to give us like a little extra period since the 15th falls on a weekend, so they'll give us till Monday to get it sent in. But if we have it done and you all have approved whatever format that winds up being in, then I would like to get it submitted Friday. Just in case there are problems.
JD, it's safe to assume that all of these project requests do fall under the criteria of that CARES Act.
Yes, Darren and I spent quite a bit of time going through each one of them. There were a couple that were, I guess maybe three, that we didn't felt within the realm of the program.
Okay.
And so we indicated that to the committee that was reviewing those. Yes, all the rest of them
Once
did.
the Board of Commissioners approves the requests,
Mm-hmm.
how soon does it take for the entities to get the funding?
Well, it should take about a month, but that's a really big asterisk that is after that. So the way the process will work is the state will take through September the 15th. They're not going to approve the program. They've told us that they're not there to approve the program. They're just there to tell us if things aren't eligible. So, so we're estimating that by September 15th, if we haven't heard back negatively on any of the projects submitted, that will be a go ahead and move forward. We have asked for the group, as primarily the nonprofits, to review their funding and set prioritization. So any projects that are beyond the 5.7 million currently, that they go ahead and prioritize more, just in case the state comes back and says, oh, project number 5, that's not eligible, or they're only eligible for a little bit of what was applied for, then we will have other plans that we can go ahead and amend what we submit. Again, that'll come back to you all, but we'll amend that and then send in an amended plan to them. So one other thing too, Bill and I visited about the end recipients of these grants, and there have been some back and forth. Would it be better to make a grant to an organization and that organization run a program? And there's some others. There are other counties that might actually be doing that. But after Bill and I chatted about it, we both felt that it would be better for the county to go ahead and make the payment to the end recipient, and then the end recipient sign a memorandum of understanding with us. So actually, we do the memorandum first before we made the payment, because in the memorandum we can make clear what the parameters of the agreement are, and that if they wind up spending money on things that are not approved, then they'll be responsible to reimburse us, because that's the agreement we made with the state, that if something's inappropriately spent, then we have to pay them back.
Sure.
So this way we can hold them on the hook to do what they're supposed to do as well.
Sounds good.
So, any questions about anything at this point? One more thing. So the group will meet Wednesday, and I expect to get a report out to you all just as soon as I can get it together after we meet. It shouldn't be too long after we meet.
Okay, sounds good.
I just have a couple of questions, JD. So,
Yes, sir.
as far as us as commissioners, we're the final say on how this money is spent.
Yes, sir.
Correct. Okay. And you said we've got about $1 million in education, about $1 million in nonprofit. We've got the large expense that the county is going to do for dispatch. And essentially, we got to get up to this $5.7 million mark. You guys are trying to whittle that down as we speak right now.
That's right.
Is there any way we can get some of this preliminary information, just so that we can try our best to understand it and know where it's coming from? I just feel like if we get it on a Wednesday afternoon and then Thursday morning we're making a decision, I don't know that we're doing our due diligence as commissioners and in the few phone calls that I probably want to make to understand, especially for-profits, nonprofits. I think it's easy to understand that there's a lot of economic hurt out there. But, knowing how this money is spent and being able to make the phone calls to the people that are requesting them or stakeholders that are making the final request, I think would be extremely beneficial to me, just so that it doesn't seem like on Thursday morning we're here to do a rubber stamp and that we haven't done at least our due diligence as elected officials to make sure we like the way that this federal money is being spent. As I've said in the past, I've got a generation of people that are all my age that know this is going to need to be paid for at some point. So I think the better we do on our due diligence as commissioners, I think it would be helpful to me even just to see where we're at right now. And then I have full faith in your guys' group to help whittle that down, and I believe that everybody you've gotten involved is perfectly capable of helping making good decisions. But if I have to be the end rubber stamp, I'd like to be somewhat more involved in the process, just so I can wrap my mind around $5.7 million in one fell swoop.
Sure. I'll send that over. Feel free to give me a call if you have any questions.
I might do that too.
Those buckets, those were buckets of requests, and the initial $1 million. That's like I said, there was quite a bit of conversation today about, well, maybe some of that can be pulled out of here. Maybe that's not all used. And there was a lot of talk today, just so you know, about the systemic side of what we can do. So you could help one individual, or you can help a whole group in a large swath. And so that was a lot of the conversation today. And even there was some, well, I'll give you an example. The city of Hayes wound up saying, hey, wait a minute, we requested $300-some thousand. We're going to reduce that down to 200-some so that those extra monies can be available to a systemic need.
So I think that's all great. For me, mainly, this is about scrutiny of the for-profit funding, the nonprofit funding of these organizations. As a small business owner who has me and a couple other staff, I don't have time to put together a request for CARES funding. I don't have the capacity of an accountant to tell me what kind of losses I have taken. So I think that was what you were alluding to in the terms of a grant program that maybe is administered by another group to give small business owners, actual small business owners, say 5, 10 employees or less, an opportunity to say, I have been financially hurt by this. Can I at least make my request? I know that's a huge, hard process, and I tend to agree with you and Bill in the terms that I think it would do better in a lot of these organizations if we just went straight from the county to them. Sometimes that's the fault of most of these federal programs is there's too many middlemen, and it's maybe what was good about the initial $1,200 that just went to everybody. It seemed equitable, and then, as opposed to just the big guys having the time and energy and staffing to make sure they got the money. Yeah, if we could do that, I think you guys are well on the way. And I think that $1.5 million, I don't know if you guys have gotten a chance to talk with any of the emergency managers. Have you guys had fun?
I have, yeah.
It sounds like a program that is just deferred costs to the county anyway in the future, and it seems like the type of thing I think Ellis County would really have a feather in their hat for in terms of a high grade emergency management system that almost is unheard of out here in western Kansas.
If I could take a second to, one of the things that I do is, especially even when it's our own folks, I tend to challenge a little bit because I want to make sure that, and they're out here too, that I want to just make sure that the link is strong. And initially when I first heard it, I said, well, that sounds a little bit weak to me. Tell me why. And so Darren came up with a whole page of bullet points talking to other people, and it is strong. There is a strong tie in that. Just so folks know, one of the things that they can do is if there is a COVID patient, we can communicate that through the system that would not be out over the airwaves, and we're breaking HIPAA laws, and nor would we want to have that on the airwaves. So it absolutely is a strong tie to the need.
And that allows an initial precaution when they know that
Exactly.
there's a potential COVID patient, okay, and or any other kind of communicable disease. I imagine this is important even outside of COVID-19 and the pandemic that we're a part of. And I would, the other nice thing that I would like to see, because Thursday morning is before a City of Hayes meeting, before Ellis, Victoria talk. I'd like to hear from the municipalities in their interest of that $1.5 million, because it's obviously not just going to be used by Ellis County and our robust EMS system. It's used by their police forces. It's used by their fire.
The college and everybody will be using it.
Yeah.
The college too. Yeah.
So I would love to hear their support. That way we don't feel like we're making a large, substantial expense just on Ellis County. And so I'm really happy to hear that from you in terms of the City of Hayes, Ellis, Victoria are on board and think that this is, like I said, deferred spending that will end up having to happen to Ellis County at some point. Sometimes using grant money like this to defer spending in the future saves us on taxes in the future.
Absolutely.
Today I invited anyone that was available to attend the meeting on Thursday. Were you wishing to see something in advance, an email or something, or?
Now, that's the Thursday afternoon meeting or the Wednesday afternoon
I'm
meeting?
sorry, Thursday morning, the 8 a.m. Thursday morning. when
Okay,
we
yeah.
take this
Even
up.
if they came to that meeting, I know it's early because Dean likes getting up early in the mornings. But
But we're not meeting until 8.
yeah. The initial was 7 o'clock. I got 2 kids at home, but no, I think that's great. Even if they just come to that meeting and would give us a voice of support, it would make me feel better about that large sum of money being spent on something that maybe seems somewhat only Ellis County when it's not at all. I mean, it's, you know, for the greater good of all the people involved and all the citizens, frankly, of the county and anybody who travels here. You know, we had a car accident on Vine. It was out of county tag. So our robust EMS system is what's going to get you help, even if you're visiting Ellis County.
I will say one more thing on that vein. I know the city of Hayes strongly supports it. In fact, that's why they reduced the request on their government transfers, because they've felt strongly that this was important.
Very good.
Very good, yeah. Is that all?
Oh, that's all I have. I'm sorry. Thank you.
Okay. County Commission reports. Commissioner Hazelhurst.
KAC board meeting / Zoom board meeting, August 27th. So that'll be my fun and excitement for 4 hours.
Okay.
Very good.
We're talking next month, we may actually get, in September, we may actually get a meet face-to-face. So.
Commissioner Ross.
Only one thing, the director of Leadership Kansas is coming to town tomorrow to prep for the Hayes session, which has been shortened and tied in with Garden City. And I am actually one of the chairs of that committee, a local, what they call a local program chair. We're going to try to have our event venue ready to bring them in, and they'll be one of the first ones that get to come into our downtown event venue when we get it open. Leadership Kansas was probably one of the most important things I've done in my professional career in terms of meeting people and understanding the intricacies of the state of Kansas and the different industries that we have. And so when we bring these, I think it's 35 people this year. It was at 40, and with COVID, they whittled it down a little bit for multiple reasons. Some class members decided they didn't want to do it this year and deferred to next. But also social distancing in the places that they are and stuff, because they're all coming in from different areas of the state. But I will tell you that we're gonna talk about schooling. We're gonna talk about rural health care. We're gonna talk about oil, and we're gonna talk about farming in Ellis County, and we're gonna do our best to teach them. So if anybody might know a little bit about that stuff and might want to speak to it, please reach out to me or Claire Guston and let us know that you might be willing to set in on a panel for this group of people. These are highly influential people throughout the state, from big companies, from small companies, entrepreneurs, elected officials. For instance, my class had lawyers, judges, the president of the Kansas Board of Regents was in my class, probably one of the more notable members of my class just in terms of people knowing him throughout the state, Blake Flanders. But this is a really neat experience, and it was sad for me this year that I didn't see a single person from Ellis County selected. So I'm going to do a better job this year of nominating people so they can put in for the request to at least be considered. And I want more people from here to experience that. But also I want to treat this class, this 35 people that are influential in our state, to know how great Ellis County is and what we add in our 2.5 million barrel of oil a year, our farming, our unbelievable Regent University, who was constantly the talk in our class of how great they were doing, and then our robust healthcare system that is helping take care of a lot of rural western Kansas. And it's why we have to discuss with Jason about hospital capacity. Even when we don't have much going on in Ellis County, we know that they might be taking care of a lot more people outside of the county. So that's all from me.
When are you doing that, Dustin and Hayes?
It will be, they were going to be in town, I believe it's the 10th and 11th of September. Yep. My building will likely not be done, but we're hoping that it'll be done enough to get them in there. Usually with those classes, it's more about having beverages after everybody talks. That's important. So we'll see if we have any beers tapped in there yet, but it's a long shot. But either way, we want to teach them about Ellis County, want to teach them about western Kansas and how our economy works, because more and more it seems like I see Kansas becoming like Colorado. in the sense that our big major metros are kind of controlling what happens to us in law and in governance. And I think it can be seen, primarily in the issue of COVID-19. I had to sit at home for 29 days without a single case in Ellis County and not run my business. So I think that if they understand what rural Kansas is, these are all influential people, maybe they do a better job if they end up becoming parts of our government and or at least can be influencers to those that make these tough decisions for our state. A lot of times they just don't even understand how we pull oil out of the ground. They don't understand, what makes our economy tick. So they sure take our tax money and divvy it out, but I'd like them to know what we do out here too.
Okay, and I have no report. We have an executive session.
Mr. Chair, I move that the Board of County Commission recess into executive session under the following exemption to the Kansas Open Meetings Act pursuant to the non-elected personnel matter exemption. Subject to be discussed is a new position. Those included will be the 3 commissioners, county administrator, and Mr. Bill Jeter, attorney.
I second that.
We have a motion and a second. All in favor say aye.
Aye. Oh,
15? 15.
15 minutes.
So, is that on here? That wasn't on here. Sorry about that. Thank you.
Sorry about that.
15 sounded
Okay,
good.
motion passes.
okay.
Very true, yeah.
Tom, congratulations.
Thank you. Congratulations.
That's Judge Dries now.
5 months.
No action, and the meeting will adjourn at 6:33.
Thank you.
School board.